Did you know that a transient ischemic attack, also known as a mini-stroke, is a temporary disruption of blood supply to the brain? These episodes can last for just a few minutes or up to 24 hours, but they should never be ignored. Imagine a temporary blockage in a water pipe, reducing water flow. Just as water flow is crucial for a household, blood flow is essential for brain function. This is similar to what happens during a TIA, where a blood clot partially or completely blocks an artery, reducing blood flow to a specific brain region. This interruption can cause symptoms like sudden weakness, numbness, or difficulty speaking. The good news? Unlike a full-blown stroke, the blockage in a TIA is temporary. This means that the symptoms often resolve quickly, sometimes within minutes. The clot often dissolves on its own or gets dislodged, restoring blood flow and reversing the symptoms. This spontaneous recovery can be misleading, making people think the episode was harmless. However, this doesn't mean TIAs are harmless. They are serious medical events that require attention. Think of them as a warning sign, a blaring siren indicating an increased risk of a future, potentially debilitating stroke. Ignoring this warning can be dangerous. Experiencing a TIA, even if the symptoms are fleeting, necessitates immediate medical attention. Quick response can help prevent a full-blown stroke. Ignoring the warning signs can have serious, long-term consequences for your brain health. It's crucial to recognize the symptoms and act swiftly. By understanding TIAs and taking proactive steps towards prevention, you can significantly reduce your risk and safeguard your well-being. Lifestyle changes such as regular exercise, a balanced diet, and managing underlying health conditions like hypertension and diabetes can make a big difference. Always consult with your healthcare provider for personalized advice and treatment options. To understand TIAs, we must first understand the intricate network of blood vessels supplying oxygen-rich blood to our brain. These vessels are like lifelines, ensuring that every part of our brain receives the necessary nutrients and oxygen to function properly. These vessels, much like a network of roads, ensure smooth functioning of our brain cells. Just as roads connect different parts of a city, these blood vessels connect various regions of the brain, facilitating communication and coordination. However, just as a traffic jam disrupts the flow on a road, a blockage in these vessels can impede blood flow to the brain, causing a TIA. This temporary disruption can lead to symptoms similar to a stroke, but they usually last only a few minutes to a few hours. One of the most common culprits behind this blockage is a blood clot. These clots can form suddenly and block the flow of blood, depriving brain cells of oxygen and nutrients, which can lead to a TIA. These clots can form due to various factors, including the buildup of plaque in the arteries, also known as atherosclerosis. Plaque is made up of fat, cholesterol, and other substances that accumulate on the artery walls over time. Imagine the plaque as rust accumulating in a pipe, narrowing the passage and increasing the likelihood of a blockage. Over time, this buildup can become significant enough to obstruct blood flow, leading to a TIA. But TIAs aren't always caused by clots originating in the brain. Sometimes, these clots travel from other parts of the body, such as the heart, through the bloodstream, eventually lodging in the brain's narrower vessels. This can happen due to conditions like atrial fibrillation, where the heart's rhythm is irregular, leading to clot formation. Sometimes, these clots travel from other parts of the body, such as the heart, through the bloodstream, eventually lodging in the brain's narrower vessels. This is why it's important to monitor and manage heart health, as issues in the heart can directly impact the brain. This is why understanding your overall cardiovascular health is crucial in preventing TIAs. Regular checkups, a healthy diet, and an active lifestyle can help maintain the health of your blood vessels and reduce the risk of TIAs. By taking care of your heart and blood vessels, you can ensure that your brain remains well nourished and functioning optimally. TIAs are often called mini-strokes for a reason. These transient ischemic attacks are essentially brief episodes of neurological dysfunction caused by a temporary disruption in blood flow to the brain. They present with stroke-like symptoms, but these symptoms are temporary, typically lasting for a few minutes and rarely exceeding an hour. Unlike a full-blown stroke, TIAs do not cause permanent damage, but they are a serious warning sign. Imagine a flickering light bulb. The light goes out briefly, but then returns to its full intensity. This analogy helps to understand how the symptoms of a TIA can come and go quickly. One of the hallmark symptoms of a TIA is sudden weakness or numbness on one side of the body. This can be alarming and may feel like a sudden loss of control over your muscles. This could manifest as a drooping face, difficulty lifting an arm, or an inability to hold objects. These symptoms can be quite distressing and may come on without any warning, or a feeling of heaviness in a leg. This heaviness can make walking or even standing difficult, and it may feel as though your leg is not responding to your commands. Other common symptoms include sudden confusion, slurred speech, or difficulty forming words. This can make communication challenging and can be very frightening for both the individual and those around them. Or difficulty understanding others, as if a communication line within the brain has been temporarily disrupted. This can lead to misunderstandings and a sense of isolation. Some individuals may experience sudden vision problems, such as blurred vision, double vision, or difficulty focusing. These visual disturbances can make everyday tasks challenging, or even temporary loss of vision in one eye. This sudden change in vision can be disorienting and may cause panic. This can be likened to a curtain being momentarily drawn over part of your visual field. It's as if a shadow has been cast over your sight, making it difficult to see clearly. Remember, even if these symptoms disappear quickly, it's crucial to seek immediate medical attention. A TIA is a warning sign that a more severe stroke could occur in the future, and timely intervention can help prevent this. Always take these symptoms seriously and consult a healthcare professional without delay. Section 4. Seeking timely intervention. Diagnosis and initial steps. Imagine you're experiencing engine trouble while driving. Would you ignore the warning lights and continue driving, or would you pull over and seek help? Similarly, experiencing TIA symptoms warrants immediate medical attention. Early diagnosis and intervention are crucial in preventing a potentially debilitating full-blown stroke. Upon arriving at the hospital, you'll undergo a series of tests to determine the cause of your symptoms. Doctors will likely perform a physical exam, checking your blood pressure, heart rhythm, and neurological function. Imaging tests, such as a CT scan or MRI, will help visualize the blood vessels in your brain and identify any blockages or areas of damage. These tests are vital in not only confirming a TIA, but also in ruling out other conditions that might present with similar symptoms. Section 5. Restoring blood flow. Treatment options for TIAs. The primary goal of TIA treatment is to prevent a subsequent, more severe stroke. This involves a two-pronged approach, addressing the immediate blockage and mitigating risk factors that increase the likelihood of future events. Medications play a significant role in managing TIAs. Antiplatelet drugs, such as aspirin and clopidogrel, are commonly prescribed to prevent blood clots from forming and further obstructing blood flow. In some cases, doctors may recommend anticoagulants, which are more potent blood thinners, to reduce the risk of clot formation, especially in individuals with certain heart conditions. In situations where the narrowing of the arteries is severe, surgical intervention might be necessary. Procedures like carotid endarterectomy, removing plaque buildup from the carotid artery, or angioplasty, using a balloon-tipped catheter to widen narrowed arteries, can help improve blood flow and reduce stroke risk.